My name is Dr. Heather Stafford, and I am a licensed acupuncturist in the state of Connecticut and the owner and practitioner at Lotus Flower Acupuncture. I wanted to take a few minutes and chat today about some frequently asked questions that I get in my practice.
I have so many questions. Can you tell me what I should wear to my appointment? Does acupuncture hurt? How long will the appointment take, and will I feel better when I leave? What are some of the things you treat in your office? And really what I want to know is how long it's going to be before you can cure me? Thanks.
Let's get to some of these questions. First one, what should I wear? I recommend wearing comfy clothes, something that we can lift up to your knee or to your elbow. However, if you don't have that option, just come as you are, because we have towels and drapes and things that we can use to make you more comfortable for your treatment. Second one, does it hurt? Shouldn't really hurt. We use a guide tube that we hold up against the skin, apply pressure, and tap the needle in. Sometimes you'll feel that millisecond of impact, but generally not at all. If you do feel it and it is a little bit uncomfortable, you can ask your practitioner to just apply a little bit more pressure with that tube, and then you really shouldn't feel anything at all. Every once in a while, we will get close to a nerve or some nerve bundles, so you can feel something that's a little zingy or a little odd. Just communicate with your practitioner and they'll make an adjustment, because it should be painless and you should be really, really comfortable. Next question, how long does it take, and will I feel better afterwards? That can also go along with, how many treatments am I going to need? Well, generally, once we have all the needles in, you're going to rest, or I call it cooking, for about 20 to 30 minutes. Some of my patients take a little bit longer. I allow my veterans a little bit more time if they need, or a regular patient if they do. Generally, rule of thumb is 20 to 30 minutes. Sometimes 30 is the hot spot for me. So once the needles are in, they should be out within 30 minutes. Will I feel better afterwards? Everybody's different. If you came to me with a headache or you had just hurt your back, you're going to notice a difference before you leave. Should be at least a noticeable difference. If you have something that's more chronic, that's going to take a little bit longer, because every acupuncture treatment builds upon itself. So we have to get the body going in the right direction. Sometimes it takes 4 to 8 treatments on something that's more chronic before someone says, wow, I'm really starting to notice a difference. This is awesome. Generally, 95% of the people I treat notice a difference within 2 to 4 treatments. Last one, what do I treat in my office? What kind of patients do I see? Who am I looking at? Well, I'm a provider for the VA, so I have a lot of veterans and things that veterans have: chronic illnesses, chronic pain, PTSD, depression, anxiety. But that doesn't sound like just veterans, does it? Sounds like everybody else too. So I would have to say, at my practice, the majority of the people come to me with 1 or 2 things. They're either in pain of some kind, or they want to work on their mental health. Whether that's just stress, anxiety, panic attacks, PTSD, depression, anything in the mental health umbrella. So with that, I'm going to give you some examples of exactly how acupuncture works on something like mental health. Listen. There are a couple of articles that I will mention about acupuncture and the vagus nerve. The first discusses transcutaneous auricular vagal nerve stimulation, or TAVNS, that may be behind the analgesic effect of auricular acupuncture and treating depression with TAVNS. What does that mean in English? That we can do acupuncture on the ear and we can help with pain and depression. So what do those studies mean, and how does that relate to stress? Well, the 5-point protocol that we do in the ear as acupuncturists is called the NADA protocol, the National Acupuncture Detoxification Association. And those 5 points that we do on the ear also stimulate the auricular branch of the vagus nerve. What is the vagus nerve? Well, the vagus nerve is the largest cranial nerve, and it's responsible for our blood pressure, our heart rate, our breathing, dilation of our pupils, some digestion, basically our sympathetic and parasympathetic nervous system. So whether we're in fight or flight or rest and digest. So part of getting over stress and reducing that stress is getting out of fight or flight or at that heightened state of stress all the time and into rest and digest. And those 5 points stimulate the nerve that controls that. So by using that protocol, we can actually kind of reset that sympathetic and parasympathetic nervous system. So that should really calm you down and help you feel more relaxed and de-stressed. So I hope this answered some frequently asked questions. If you have any more, don't hesitate to reach out. There's so many other ways I can tell you that acupuncture works and can be beneficial for you, but this video would be way too long. Again, my name is Dr. Heather Stafford, and I practice here in Connecticut. I have 2 offices, one in the Brookfield area and one in Bethany. I am a provider for the VA, so if you know any veterans, tell them to give me a holler and we can chat. Take care and have a great day.